Welcome to Chapter 23, entitled OTC Medication and Pharmaceutical Care. With the increasing availability and use of over-the-counter, abbreviated as OTC, or non-prescription medicines by consumers globally, pharmacists have an integral role in delivering pharmaceutical care to support safe and appropriate over-the-counter medication use. This chapter provides an overview of over-the-counter medication use within the context of primary care and self-care. It outlines the role of pharmacists in relation to over-the-counter medicines, details the medication-centered and service-oriented systems for delivering pharmaceutical care relevant to consumer over-the-counter medication use, and discusses current and future scopes of practice within the context of over-the-counter medication and pharmaceutical care. We will now look at an introduction. Pharmaceutical care is regarded as the pharmacist's contribution to the care of individuals in order to optimize medicines use and improve health outcomes. Pharmaceutical care encompasses both prescription and over-the-counter, abbreviated as OTC, or non-prescription medicines, that is, conventional medicines available to consumers without the need for a prescription, complementary and alternative medicines, abbreviated as COMS, will be discussed separately in this chapter. The increasing and widespread availability of over-the-counter medicines globally has contributed to the need for pharmacists to adapt, refine, and upskill in order to enable the provision of consumer-centered pharmaceutical care in relation to over-the-counter medicines. Multiple opportunities exist for pharmacists to leverage their expertise and to demonstrate the value of pharmacists and community pharmacy, which include the following. 1. Accessibility. From a logistical perspective due to location and hours of operation, as well as from an economic perspective where professional advice can be sought from pharmacists in many cases without extensive out-of-pocket costs to the consumer. 2. Expertise in health and medicines. And 3. Immediate access to both healthcare professional advice as well as medications within the same setting. Pharmacists are key healthcare professionals who are the first point of contact for many consumers with minor ailments and are therefore well situated within primary care settings such as community pharmacies to deliver pharmaceutical care. As over-the-counter medicines are able to be used by consumers as part of their self-management of minor ailments, the changing landscape of over-the-counter medication use and the widening of the scope of practice of pharmacists have led to a more extensive role for pharmacists within the area of primary care. And now we will look at primary care, self-care, self-medication, and over-the-counter medicines. The Declaration of Alma Ata, of 1978, was seminal in providing a vision for primary health care to help facilitate improved health outcomes for everyone. Within the broader framework of primary health care is regarded by the World Health Organization as first contact, accessible, continued, comprehensive and coordinated care. In light of this, it is clear that community pharmacy and pharmacists are ideally situated and are instrumental in providing primary care. Self-care is what individuals, families and communities do with the intention to promote, maintain, or restore health and to cope with illness and disability with or without the support of health professionals such as pharmacists, doctors, dentists and nurses. It includes but is not limited to self-prevention, self-diagnosis, self-medication and self-management of illness and disability. Over-the-counter medication use forms an important element of self-care. A definition compiled and used for the purposes of a project evaluating self-care systems that was commissioned by the European Commission detailed, evidently, consumer self-medication using over-the-counter medicines is a key component within the broader self-care continuum. In particular, The role of pharmacists in promoting and enabling self-care has been extensively outlined and discussed in the report recently published by the International Pharmaceutical Federation, entitled, Pharmacy as a Gateway to Care, Helping People Towards Better Health. Pharmacists are well positioned and have suitable expertise to adequately assist consumers who choose to manage their conditions via self-medication, i.e., the use of over-the-counter medicines. The contributions of pharmacists are particularly important across multiple contexts, ranging from populations of higher socioeconomic status to areas with limited access to healthcare professionals such as general practitioners, for example in rural areas, to other contexts where accessibility to healthcare may also be limited for certain populations and/or other reasons, for instance due to affordability of healthcare. There has been a clear increase in the number and range of over-the-counter medicines made available over the years. Moreover, the use of over-the-counter medicines is highly prevalent among consumers, with consumers reporting a need for pharmacy advice on over-the-counter medicines. Consequently, pharmacists have an increased capacity to help consumers manage minor ailments and meet the increasing requests for over-the-counter medicines. In addition to timely, ready access to over-the-counter medicines for consumers, a number of positive economic benefits for multiple parties or stakeholders may also be seen as a result, such as 1. Savings for the healthcare system as a whole, for example, via reduced utilization of limited healthcare resources and/or medication-related costs redirected to consumers. 2. Reduced pressures on healthcare professionals, for instance general practitioners, in relation to consultations about minor ailments that are able to be adequately managed in community pharmacy settings. And/or 3. Potential savings for consumers regarding reduced wait times associated with seeing a general practitioner, avoidance of unnecessary on-costs associated with visits to the general practitioner, in addition to other indirect benefits of increased convenience. Thus, increasing self-care and self-management alongside increasing access to over-the-counter medicines via switching medicines from prescription to over-the-counter status has contributed to expanded opportunities for pharmaceutical care to be provided in relation to over-the-counter medicines, and within the context of primary care. Next we will discuss over-the-counter medicines, the role of the pharmacist. Pharmacists are the primary healthcare professionals who advise on, recommend, and participate in the appropriate supply of over-the-counter medicines, much like doctors are the primary prescribers for prescription medicines. The role of a pharmacist is multidimensional, where pharmaceutical care provision by pharmacists is imperative across the treatment continuum for over-the-counter medicines, that is, at all time points that involve the use of over-the-counter medicine or medicines, in managing the specific ailment or ailments. Pharmacists' roles and responsibilities comprise 1. Appropriate diagnosis of the ailment or ailments, that may in turn be managed using over-the-counter medicines. 2. Provision of appropriate, evidence-based recommendations for over-the-counter medicines for the individual consumer. 3. Facilitation of consumer decision-making regarding self-medication. 4. Promotion of quality use of medicines, e.g., safe and effective use, prevention of misuse and abuse of over-the-counter medicines. 5. Identification and appropriate handling of potential drug-drug interactions, in particular with other prescription, non-prescription, and complementary and alternative medicines, abbreviated as COMS, being used by the consumer. 6. Ongoing monitoring of over-the-counter medication use by consumers. 7. Provision of health and over-the-counter medicines information that supports the consumer in engaging in safe and appropriate self-care and self-medication, which can in turn improve consumers' health literacy surrounding self-medication as part of self-care. 8. Engaging in and advising on appropriate referral pathways where treatment with over-the-counter medicines has been proven to be inappropriate and/or ineffective. And 9. Engaging in appropriate follow-up to ensure continuity of care where a consumer has been referred on to another healthcare professional to manage the medical condition or ailment. These responsibilities are firmly embedded in pharmacy practice and pharmaceutical care provided for symptom and product-based requests in relation to over-the-counter medicines, as evidenced by existing professional practice standards and protocols such as WAM, ASMETHOD, What Stop Go, and CARA. Importantly, professional practice standards and protocols provide a framework that enable an organized and systematic approach for pharmacists' clinical skills to be actively utilized, and for due care to also be exercised by pharmacists when handling over-the-counter medicine requests. The use of such protocols to guide pharmacists' interactions with consumers allows for potential medication-related problems to be identified in a timely manner that is still respectful of consumers' autonomy in a self-medication context. Next we will look at systems for delivering pharmaceutical care for over-the-counter medicines. Pharmaceutical care is typically provided for over-the-counter medicines through one of two broad approaches, namely 1. Medication-centered systems, which are primarily focused around the supply of specific over-the-counter medicine or medicines, for appropriate consumer use. And 2. Service-based systems that seek to facilitate optimized pharmacist engagement in the management of the ailment, which may be complemented by over-the-counter medication use. Next we will discuss medication-centered systems. The availability and ready access to over-the-counter medicines enable pharmacists to provide pharmaceutical care and address the patient's healthcare needs at the point of care within a primary care setting. Subsequently, the availability and type of over-the-counter medicines, which differs between countries, enables pharmacist interventions and provision of advice to support the use of medicines to manage specific ailments. In addition to this, pharmacists should be cognizant of the quality of written information accompanying over-the-counter medicines found on the label, box and/or accompanying leaflet, where available. The content and language used to convey the over-the-counter medicine information as well as how it is presented in these written information sources may not be optimal across all products available for consumers. Pharmacist-delivered counseling therefore should complement the written information provided with the over-the-counter medicine or medicines, and ensure that consumers of all health literacy levels are equipped with adequate, understandable information to use over-the-counter medicines safely and appropriately. Furthermore, pharmacists should consciously provide balanced information on all available treatment options that are appropriate for the individual consumer to ensure that evidence-based shared decision-making is promoted between the consumer and pharmacist during minor ailment and over-the-counter medicine-related consultations. And now let's discuss over-the-counter medicine scheduling, the switch, and pharmacist-only medicines. In addition to products being classified as either prescription or over-the-counter medicines can be further divided into subcategories depending upon the regulatory context, a specific area, region that is governed by the same set of rules and regulations, and implemented legislation surrounding the scheduling of medicines. For instance, in certain countries, although some over-the-counter medicines may be sold in retail outlets other than pharmacies, there are certain over-the-counter medicines that are only permitted to be sold in pharmacies. In a 2017 survey conducted by the International Pharmaceutical Federation, abbreviated as FIP, of countries, territories that had at least one FIP member organization or candidate member organization, mean response rate 72.6%, N equal to 72 to 79 responses, varying between the survey sections. 23 regulatory contexts were reported to have all over-the-counter medicines located behind the counter in the community pharmacy. 19 regulatory contexts had over-the-counter medicines available for self-selection in the pharmacy. In contrast, 30 regulatory contexts reportedly had schedules of over-the-counter medicines that are either available for consumers to choose themselves or situated behind the counter. For instance, in countries such as Australia, New Zealand, and the UK, an additional subcategory of over-the-counter medicines known as pharmacist-only or P medicines is available. Pharmacists are required to be directly involved in the supply of these medicines, thus ensuring that consumers' symptoms are appropriately assessed by pharmacists and that consumers have access to timely pharmacist advice to support the quality use of these over-the-counter medicines. Over the years, the scope of pharmaceutical care in the context of over-the-counter medicines has widened in tandem with the increased availability of such medicines for over-the-counter purchase. There have been a number of notable examples of medicines that have been switched from prescription only to over-the-counter status in multiple countries. A few examples include the following. 1. Oral emergency contraceptives, providing women with timely access to emergency contraception when needed. 2. Chloramphenicol, enabling pharmacists to facilitate the treatment of bacterial conjunctivitis. 3. Proton pump inhibitor or inhibitors, which provide an additional treatment option, in addition to other over-the-counter medicines such as H2 antagonist or antagonists, and antacids, for recommendation by pharmacists to those suffering from symptoms of heartburn. 4. Orlistat, which provides pharmacists with a pharmacological option that can be recommended to consumers for use as part of weight management. 5. Famciclovir, which can be used for the treatment of cold sores. 6. Triptans for use in migraines. And/or 7. Topical and/or oral antifungal agents for the treatment of vaginal thrush. Although the above examples are not exhaustive, they illustrate the breadth of health issues that can be managed using over-the-counter medicines provided that their supply is accompanied by appropriate pharmaceutical care delivered by pharmacists. In those countries with pharmacist-only over-the-counter medicine schedules, the relevant pharmaceutical societies or professional organizations have developed practice standards, guidelines and/or resources to support pharmacy practitioners, pharmacists, pharmacy technicians and/or pharmacy assistants in the appropriate provision of these medicines and broader pharmaceutical care. An example includes the guidelines published by the Pharmaceutical Society of Australia. These guidelines provide pharmacists with informational support to assist in deciding whether the supply of the particular medicine is appropriate, taking into account the range of factors that may impact the decision-making process undertaken by the pharmacist, and reinforce the key counseling points to be delivered to consumers. Notably, with a change in the scheduling of medicines, for instance a prescription medicine becoming available as a pharmacist-only medicine, pharmaceutical societies have in general published new and/or updated guidelines to assist pharmacists in ensuring the appropriate supply of such medicines. A few examples of medicines for which practice standards are available from the relevant pharmaceutical society and/or pharmacy council in Australia, UK and/or New Zealand include the following. 1. Oral emergency contraceptives. 2. Analgesics containing codeine, Note that since the 1st of February 2018, codeine is no longer available over the counter in Australia. 3. Proton pump inhibitors. 4. Orlistat. And 5. Chloramphenicol. Although many pharmacist-only medicines are intended for use in the short term to manage acute symptoms, there are also some pharmacist-only medicines available for people to use to manage chronic medical conditions. It is therefore important for pharmacists to discern appropriate, patient-centered strategies that can be implemented as part of the management of acute and chronic medical conditions. The Protocol for the Sale and Supply of Pharmacist-Only Medicines for Chronic Conditions, published by the Pharmacy Council of New Zealand, aims to support pharmacists in differentiating between the use of pharmacist-only medicines for acute and chronic conditions. It is compulsory for pharmacists to adhere to this protocol when a person presents with a chronic medical condition, such as obesity, for which a pharmacist-only medicine can be used and is supplied by the pharmacist to treat the condition. Other examples of medicines that can be supplied without a prescription in certain situations by pharmacists in New Zealand for chronic conditions include sildenafil for erectile dysfunction and topical adapalene for acne. A few examples of medicines for which practice standards are available from the relevant Pharmaceutical Society and/or Pharmacy Council in Australia, UK and/or New Zealand include the following. 1. Oral emergency contraceptives. 2. Analgesics containing codeine. Note that since the 1st of February 2018, codeine is no longer available over the counter in Australia. 3. Proton pump inhibitors. 4. Orlistat. And 5. Chloramphenicol. Although many pharmacist-only medicines are intended for use in the short term to manage acute symptoms, there are also some pharmacist-only medicines available for people to use to manage chronic medical conditions. It is therefore important for pharmacists to discern appropriate, patient-centered strategies that can be implemented as part of the management of acute and chronic medical conditions. The Protocol for the Sale and Supply of Pharmacist-Only Medicines for Chronic Conditions, published by the Pharmacy Council of New Zealand, aims to support pharmacists in differentiating between the use of pharmacist-only medicines for acute and chronic conditions. It is compulsory for pharmacists to adhere to this protocol when a person presents with a chronic medical condition, such as obesity, for which a pharmacist-only medicine can be used and is supplied by the pharmacist to treat the condition. Other examples of medicines that can be supplied without a prescription in certain situations by pharmacists in New Zealand for chronic conditions include sildenafil for erectile dysfunction and topical adapalene for acne. Next we will discuss facilitation of safe and evidence-based use of complementary and alternative medicines. Complementary and alternative medicines, abbreviated as COMS, are available for purchase by consumers in a number of settings where there may or may not be immediate access to advice from a healthcare professional. As many consumers do obtain such medicines from pharmacies, pharmacists have a particularly important role in providing evidence-based recommendations tailored to the individual consumer to support their safe and effective use. A systematic review conducted by Ung and colleagues identified and outlined key roles and responsibilities for pharmacists in relation to complementary and alternative medicines, which were to 1. Recognize and inquire about their use by consumers. 2. Possess knowledge about complementary and alternative medicines. 3. Facilitate the safe and effective use of complementary and alternative medicines by consumers. 4. Record consumer complementary and alternative medicine use. 5. Engage in the reporting of adverse drug events associated with complementary and alternative medicine use. 6. Educate consumers. And 7. Engage in interprofessional collaboration in relation to consumer complementary and alternative medicine use. As an example, the Pharmacy Council of New Zealand has published Complementary and Alternative Medicines, Best Practice Guidance for Pharmacists. This guidance reiterates many of the above key roles and responsibilities. Accordingly, pharmaceutical care relating to over-the-counter medicines is also inclusive of complementary and alternative medicines. Moreover, it is important to recognize that there is no fundamental distinction in the pharmaceutical care that should ideally be provided by pharmacists between the types of over-the-counter medicines available. There is a need for pharmacists to acknowledge the role of complementary and alternative medicines from the consumer's perspective in facilitating self-care and ensure that consumers' use of complementary and alternative medicines is considered and discussed as part of an integrated, holistic approach to patient-centered care. Similarly, in instances where consumers choose to utilize complementary and alternative medicines for which there is less evidence for efficacy, appropriate, unbiased information should be offered to consumers by pharmacists. However, if consumers choose to proceed in engaging in self-medication using complementary and alternative medicines in situations where there are minimal safety implications, the choice to do so should be respected. Next we will discuss clinical interventions. Pharmaceutical care provided in relation to over-the-counter medicines is an opportunity for timely medication reconciliation regarding over-the-counter medicines used by consumers. Moreover, despite their over-the-counter availability, ill-considered and/or inappropriate use of over-the-counter medicines still carries a number of risks for the consumer. Consumers do not always discuss or want to discuss their over-the-counter medication use with their doctor, and doctors may not always inquire about their over-the-counter medication use during a consultation. Thus, pharmacists are in an ideal position to optimize consumer self-medication strategies via timely clinical interventions, as well as be the link between consumers and doctors, strengthening interprofessional collaboration and effective consumer self-management. These important efforts can be initiated by pharmacists to promote the health and well-being of consumers. As with prescription medicines, there is also the ongoing potential for medication-related problems to arise with over-the-counter medicines. A study conducted by Westerland and colleagues over 15 years ago found that over a 10-week period, 1425 medication-related problems and 2040 interventions were reported by 308 pharmacists from 45 Swedish pharmacies. Similarly, Eickhoff et al. Found that medication-related problems linked to over-the-counter medicines were identified in 17.6% of consultations, 2206 per 12,567, with consumers, as documented by study pharmacists. Broad types of medication-related problems pertaining to over-the-counter medicines previously identified include 1. Inappropriate product requests or self-medication. 2. Incorrect dosage or planned treatment duration, and/or 3. Suboptimal understanding of the medicine's indication. Williams et al. Estimated that approximately 485,912 interventions were conducted within Australian community pharmacy settings per year in relation to over-the-counter medicines that can only be sold in pharmacies, pharmacy and pharmacist-only medicines. They calculated and extrapolated data from 2 studies, where actual data were obtained from each study pharmacy, N equal to 934 and N equal to 101, respectively, for a designated study period of 2 weeks between November 2004 and September 2005. Furthermore, 101,324 interventions, that is 21%, were classified as potentially being life-saving and/or avoiding serious harm. When considering the number and nature of interventions that would be conducted by pharmacists as part of routine practice within community pharmacies globally, the impact of these interventions in both preventing and addressing medication-related problems emphasizes the unique opportunities for pharmacists to influence over-the-counter treatment decision-making, medication use, and safety, thus continuing to be an important part of the overall healthcare system. Next we will discuss service-oriented systems. Many pharmaceutical care-related activities conducted by pharmacists are closely linked to the supply of over-the-counter medicines, whether it be via direct product requests or symptom-based requests that may or may not eventuate in the actual supply of over-the-counter medicine or medicines. Service-oriented systems, although complemented by medication-oriented systems, help to facilitate the added engagement of pharmacists in delivering services that can help treat and/or manage specific medical conditions in addition to pharmacists' baseline supply functions. Thus, the primary focus of a service-oriented system is the service itself, rather than the medicine, which is targeted at addressing a specific consumer health need. The services provided are sometimes known as cognitive pharmaceutical services or professional pharmacy services. And now we will look at cognitive pharmaceutical services or professional pharmacy services, paying attention to some examples. The provision of pharmaceutical care by pharmacists in community pharmacy settings has increased over the years. However, there are differences in the uptake and types of services being offered internationally. In order to better utilize pharmacists' expertise in helping consumers manage their medical conditions, cognitive pharmaceutical services, also known as professional pharmacy services, have been developed and implemented in practice. Such services may exist at a local level, i.e., services specifically developed to meet the needs of the population serviced by a single pharmacy, or may involve more standardized services that are remunerated via government funding. Services developed to address a particular health need or medical condition which may involve the use of over-the-counter medicines and/or therapeutic goods include, for example, 1. Condition-specific management and services delivered as part of broader minor ailment schemes. 2. Wound care services, which may involve the dressing of wounds, and relevant consumer education and counseling to support the cleaning, dressing of wounds at home. 3. Smoking cessation services, facilitated by the over-the-counter availability of nicotine replacement therapy options. And 4. Weight management services, which may involve the use of products such as over-the-counter Orlistat or very low-calorie diet products that are sold in pharmacies, recommended in conjunction with counseling on diet and lifestyle factors which may or may not be part of a structured, branded weight loss program. Of particular relevance are minor ailment schemes or services. Previous systematic reviews of remunerated pharmaceutical care services have identified minor ailment schemes that are offered in countries such as the UK and Canada. As a remunerated service, such schemes provide pharmacists with the opportunity to manage certain minor ailments in the community pharmacy setting. This involves the pharmacist completing a consultation with the consumer, which would involve appropriate questioning to enable the diagnosis of the minor ailment, provision of treatment where applicable, appropriate counseling, and/or appropriate referral provided. Depending on the scheme's inclusions, minor ailments covered may encompass conditions such as 1. Symptoms relating to colds or coughs. 2. Hay fever. 3. Dermatological-related ailments such as nappy rash, dermatitis, eczema, and athlete's foot. 4. Head lice. 5. Oral or vaginal thrush. And/or 6. Gastrointestinal related ailments such as indigestion, diarrhea, constipation, and hemorrhoids. A systematic review of the evidence for UK minor ailment schemes found that 68 to 94% of consumers who utilised the scheme had reported complete resolution of the ailment. Positively, many studies noted overall consumer satisfaction with the service provided as part of the minor ailment scheme and consumer willingness to utilise the service again in future. Although further comprehensive, ongoing economic evaluations of the minor ailment schemes are still needed. It has been reported that the costs associated with reimbursing pharmacists' consultation times for managing minor ailments are in general less than that associated with general practitioner consultations. This is suggestive of positive savings for the overall healthcare system as well as the easing of pressures across other primary care settings. Netcare, an initiative of Pharma Suisse, is an example of a collaborative primary healthcare service delivered through community pharmacies. It has involved the development of evidence-based decision support tools for 24 medical conditions commonly presented by consumers in primary care. The decision support tools can be utilized by a trained pharmacist in a private consultation area within the pharmacy, with information documented using a standardized form. When an eligible and willing consumer is assessed using the relevant decision support tool or tools, there are 3 possible outcomes. 1. The pharmacist manages the ailment, with medicine or medicines, provided over the counter where necessary. 2. The ailment is managed by the pharmacist with support from a doctor via videoconference, thus providing a pathway for appropriate triage and an opportunity for interprofessional collaboration in the management of the consumer's ailment or ailments. Or 3. The consumer is referred for medical care from a GP and/or emergency services as required. In a study by Ernie and colleagues, 3,146 out of 4,118 Netcare cases, that is 76%, documented between April 2012 and January 2014 only required pharmacist intervention, and upon follow-up, the majority of these consumers reported complete symptom resolution or marked symptomatic relief. Although not specific to over-the-counter medicines, this is one example, similar to minor ailment schemes, where system-based approaches have sought to optimize and highlight the potential for effective pharmaceutical care delivered in the context of common ailments in primary. Next we will discuss current practice and future scope for practice. Pharmacists are trained health and medicines experts. When considering the prevalence of polypharmacy as well as the varied health needs of consumers, the provision of pharmaceutical care relating to over-the-counter medicines is not conducted in silo to other systems of pharmaceutical care that are non-specific to over-the-counter medicines, for instance medication reviews or medication therapy management. Patient-centered care that supports the appropriate consumer use of over-the-counter medicines within their overall healthcare plan or regimen should remain the mainstay for pharmaceutical care that seeks to facilitate self-care and self-medication. As the availability of over-the-counter medicines continues to increase, future medication switches will further opportunities for pharmacists to contribute to self-management within the over-the-counter treatment options available within each specific regulatory context. This is applicable to medicines switched from prescription to over-the-counter status, and vice versa, where medication risks have been associated with their over-the-counter availability. Opportunities for continuing consumer education and counseling within this context reinforce and ensure that pharmacists and the pharmaceutical care provided by pharmacists in relation to over-the-counter medicines remain highly relevant. Although cognitive pharmaceutical services being provided by community pharmacists have increased over the years, the supply function inherent within community practice settings that are more skewed toward medication-oriented systems financially supports the employment of pharmacists and pharmacy staff to provide these services. Development and availability of alternative funding systems that reimburse for pharmaceutical care linked to over-the-counter medicines, as seen with minor ailment schemes, will enable pharmacists to be remunerated for their time rather than solely via the sale of an over-the-counter medicine or product. The importance of this is reiterated in one of the recommendations in the recently adopted FIP Statement of Policy, Pharmacy, Gateway to Care, which recommends that government and insurers assure proper compensation for pharmacist self-care services, and encourage health sector collaboration to optimize efficiency, safety and value. Next we will discuss current practice and future scope for practice. Pharmacists are trained health and medicines experts. When considering the prevalence of polypharmacy as well as the varied health needs of consumers, the provision of pharmaceutical care relating to over-the-counter medicines is not conducted in silo to other systems of pharmaceutical care that are non-specific to over-the-counter medicines, for instance medication reviews or medication therapy management. Patient-centered care that supports the appropriate consumer use of over-the-counter medicines within their overall healthcare plan or regimen should remain the mainstay for pharmaceutical care that seeks to facilitate self-care and self-medication. As the availability of over-the-counter medicines continues to increase, future medication switches will further opportunities for pharmacists to contribute to self-management within the over-the-counter treatment options available within each specific regulatory context. This is applicable to medicines switched from prescription to over-the-counter status, and vice versa, where medication risks have been associated with their over-the-counter availability. Opportunities for continuing consumer education and counseling within this context reinforce and ensure that pharmacists and the pharmaceutical care provided by pharmacists in relation to over-the-counter medicines remain highly relevant. Although cognitive pharmaceutical services being provided by community pharmacists have increased over the years, the supply function inherent within community practice settings that are more skewed toward medication-oriented systems financially supports the employment of pharmacists and pharmacy staff to provide these services. Development and availability of alternative funding systems that reimburse for pharmaceutical care linked to over-the-counter medicines, as seen with minor ailment schemes, will enable pharmacists to be remunerated for their time rather than solely via the sale of an over-the-counter medicine or product. The importance of this is reiterated in one of the recommendations in the recently adopted FIP Statement of Policy, Pharmacy, Gateway to Care, which recommends that government and insurers assure proper compensation for pharmacist self-care services, and encourage health sector collaboration to optimize efficiency, safety and value. A range of training opportunities can be used to support and provide feedback on current practices surrounding pharmacist supply of over-the-counter medicines, for instance via the use of mystery shoppers or pseudo-patients as one approach. Furthermore, existing standards, guidelines, or protocols can be used and adapted by countries where there may be limited professional practice standards and/or guidelines that support pharmaceutical care provision with respect to over-the-counter medicines. For instance, the detailed approach and protocol utilized in New Zealand for the supply of pharmacist-only medicines for chronic medical conditions is one such system that may be of use for other countries to reference and adapt accordingly. Improved documentation associated with pharmaceutical care delivered for consumers regarding over-the-counter medicines, for instance, may facilitate improved medication reconciliation and review, and improved continuity of care and information exchange between members of the healthcare team. Utilization of emergent e-health and m-health initiatives such as electronic health records, where available, as part of this process may also become more prevalent and therefore necessary when moving forward. When considering that self-care, by its definition, can be undertaken by consumers with or without the support or help of healthcare professionals, suboptimal health literacy levels of consumers can significantly impact self-management and subsequent self-medication using over-the-counter medicines. Inadequate health literacy within the broader population remains a prevalent and ongoing issue. Consequently, there will be an ongoing imperative role for pharmacists both as part of current practice and future scope of practice to continually seek ways to improve consumers' health literacy. These concepts have been aptly encapsulated in the recommendations for pharmacists included as part of the aforementioned FIP Statement of Policy, reproduced in Table 23.1. and should continually drive pharmacists to seek ways to fulfill their duty of care and enhance the pharmaceutical care provided to consumers of over-the-counter medicines, in order to improve consumers' health outcomes and quality of life. Pause the video and carefully scrutinize Table 23.1 summarizing recommendations for pharmacists included in the FIP Statement of Policy Pharmacy. Gateway to care before advancing to the next slide. Pause the video and carefully scrutinize Table 23.1 summarizing recommendations for pharmacists included in the FIP Statement of Policy Pharmacy. Gateway to care before advancing to the next slide. Thank you.